My name is Myrna Heydenrijk. I work as a rehabilitation physician and clinical researcher at the Erasmus Medical Center and Rijndam Rehabilitation. In this video, I present the results of our study, titled Meaningful Outcomes for Children and Caregivers Attending a Pediatric Brain Center. What do they value most? Our project was among the first in the Child Brain Lab. The Child Brain Lab is the research facility for brain development and functioning of the Pediatric Brain Center. In the Pediatric Brain Center, children with brain-related disorders receive care from multidisciplinary teams. The children have various conditions, such as cerebral palsy, spina bifida, neurogenetic developmental disorders, or acquired brain injury. These children often experience limitations in their daily functioning, involving their mental functions, their mobility, communication, self-care, and social life. In the Brain Lab, a long-term systematic follow-up has been developed to monitor their development and functioning using patient-reported outcome measurements and clinical tests. And nowadays, as a result of value-based healthcare, it's highly recommended to include those outcomes that are valued important by the patient. But how do we know which outcomes are important for our children and our parents? Can we as professionals determine which outcomes those are? No, we cannot. And that's why we decided to ask them. Therefore, we developed a patient validation survey, which was the result of combining the perspectives of children and caregivers of the Child Brain Center, the outcomes that are important for professionals, and we did a literature search for outcomes in similar patient groups. That resulted in a list of 104 outcomes, which we aggregated into a list of 85 salient outcomes. And those were used to compose the patient validation survey. Respondents were asked to prioritize these outcomes on a 9-point scale, and those outcomes that were ranked very important by more than 70 of the respondents were considered meaningful. Here you see the demographics. 31 children were included in the study. Their mean age was 8 years and 7 months old. Almost half was male, and you can see that they were diagnosed with various conditions. 33 surveys were completed by the respondents. 4 by children, 5 by children together with their caregivers, and 24 by caregivers themselves. The results are shown in this slide. We found 27 meaningful outcomes that covered various aspects of health and functioning, such as mental functioning, learning ability, mood, sleep, but also fitness, fatigue or energy, and very important sensory functions, hearing, seeing. Looking at more activity level, meaningful outcomes concerned mobility, self-care, communication, and interpersonal relationships. And of course, quality of life and emotional well-being were also indicated as meaningful. All these outcomes are already previously found in research. Newly identified outcomes were outcomes concerned caregivers, such as survival and coping with diagnosis, and environmental factors, such as transitions between life stages, healthcare systems or educational systems, or social inclusion. In conclusion, perspectives of caregivers and children improve our understanding of meaningful outcomes. As I just showed you, meaningful outcomes in children with brain-related disorders or neurodisability cover multiple aspects of health and functioning. And finally, we recommend to include caregiver outcomes and environmental factors in future outcome sets. Thank you for your attention. If you have any questions or comments, please feel free to contact me by email. Thank you.